So I'm going to show you how to use an AED, which stands for Automated External Defibrillator. And so there's a couple different components of it, and what it does is it's going to shock your heart back into rhythm when someone's in cardiac arrest. And so it just uses electricity to be able to shock their heart back into that normal rhythm. So what's in this kit here, this is just a trainer, so it's a little bit smaller, but you can see that there's an on button and a shock button. So that's going to be the only buttons. There's not really settings or anything like that. And then you have some pads, and so you have the pads that are going to be placed on the chest. You're going to put one pad right there, and then the other pad is going to be placed on the side of their chest, just right over here. And Christian's going to show you in a video in just a second on how this works and kind of the different components of it. And it's going to work slightly different for a child as far as where the pads are placed, but everything else is going to be the same, whether if it's an adult or a child. And so just make sure that you pay attention to where those pads are placed and that it needs to go on the bare chest. There's also usually going to be a part of the kit that's going to have scissors so you can cut the clothing out of the way, and there's usually going to be a razor in there as well, so if there's a hairy chest, we can shave that area for the pad to go. And we do need to remove all clothing for this person so we have a bare chest to work with this defibrillator so the defibrillator can work properly. So just go ahead and we're going to watch the video with Christian.
Keep in mind, someone is still doing CPR as you are about to apply the pads to get the AED ready. That is vital to keep the brain alive before you can even start the heart up again. So, you have gotten your AED, you now take it out of the box, someone is doing CPR next to them, you are above them. So the first step is going to be to turn on the box by holding down the green button.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So, I would then get the adult pads, and pictured, it shows you where to place them. So the right pad is going to go on the upper right pectoral, so the upper right chest. The other one goes on the lower left abdomen, so right on the left side of their stomach.
Plug in connector.
And this is going to shock in here, through the heart, and exit here. So this only shocks the tissue from here to try and get the heart active again. Next, I'm going to plug in the pads.
Analyzing heart rhythm.
It is checking to see if it is a correctable
Do
rhythm.
not touch the patient.
So, I will then stand back and tell everybody, clear, clear, no more touching, do not
Shock advised.
stop doing CPR, it advised the shock.
Charging.
So, it was a correctable rhythm,
Stay clear of patient.
it advised the shock. Again, everyone clear,
Another
clear.
shock now.
I will press the
orange
flashing
button
orange
now.
button to initiate the shock, hit the shock button.
Shock delivered.
Once you've shocked them, this will have you initiate CPR once more because there's no guarantee the heart starts with the first shock. So you would resume CPR, and then another minute later after CPR, this box will come back online. You do not have to turn it on, it will remain on the entire time. It will tell you if another shock is required. And if these shocks aren't working, you have been doing CPR intermittently in between, allowing for their brain to still be active by the time the ambulance would arrive, and they can initiate a stronger shock with one of their defibrillators. For those under 55 pounds, you use child pads. The procedure is identical except for one distinct difference, which is different pads are used. Now again, the pads picture where to place them. So one pad goes on directly on the front, right on the sternum, so the very center of the chest, whereas the other one is going to go on the exact same spot on their back. So flip them over, apply the pad onto their back, and turn them back. The exact same rules apply, it's just the pads are positioned differently for a child's heart as they would for an adult.